السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومتري. Review of Prometric Test Question. This is lecture number 11 in medication and number 28 in Ghaith review. Today we are going to discuss 5 questions from question number 157 up to question number 161. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 157. Doctor ordered to give 75 ml per hour over 12 hours of normal saline. How many total ml should be given? The options are number A 450 ml, number B 600 ml, number C 900 ml, number D 1000 ml. وقف الفيديو هنا واختار الخيار المشهور سهل. The correct option is option number C 900 ml. ليه اخترنا الخيار رقم C؟ نشوف rational. This is the question. Use the following equation. IV flow rate in ml per hours multiplied by time in hour equal total volume in ml. So 75 multiplied by 12 equal 900. So the correct option is option number C. Question number 158. A 37-year-old female presented to the emergency room with complaint of symptomatic bradycardia. Appropriate nursing intervention include establishing intravenous access. What is the possible drug to be given in the IV solution? The options are number A, digoxin, number B, atropine, number C, anticoagulant, number D, calcium channel blocker. وقف الفيديو هنا واختار الخيار المشهور سعيد. The correct option is option number B, atropine. ليه اخترنا الخيار رقم B؟ نشوف rational. Based on the above information, the possible drug to be given in the IV solution is atropine. Why? Because atropine is used to treat low heart rate experienced by the patient. So the correct option is option number B, atropine. Digoxin is used to treat heart failure and certain type of irregular heartbeat. And anticoagulants are medicines that help prevent blood clots. And calcium channel blocker are medications used to lower blood pressure. So the correct option is option number B, atropine. Question number 159. A 25-year-old woman present to the emergency room with lethargy, decreased reflexes, hypoventilation, hypotension, and fixed and dilated pupils. A family member who is accompanying the patient has an empty bottle of diazepam value, which the label state was recently refilled. The family member also indicates that the patient has a depression. What intervention should the nurse expect to administer? The options are number A, naloxone, number B, active charcoal, number C, tap water enema, number D, magnesium sulfate to reduce the risk of seizure. وقف الفيديو هنا اختار الخيار المشهور سعيد. The correct option is option number B, active charcoal. ليه اخترنا الخيار رقم B؟ نشوف rational. From the scenario, it appears that the patient attempted suicide. with diazepam, and symptom and sign also indicate diazepam poisoning. So the nurse expects to administer diazepam antidote, which is flumazenil. If not available, use active charcoal. This medication is used in emergency for treatment of certain kinds of poisoning, and it helps prevent the poison from being absorbed from the stomach into the body. So the correct option is option number B, active charcoal. Question number 160. Nurse gives health education to patient in outpatient department regarding a medication. She told him avoid working outdoors in a hot weather, excessive sweating, and taking adequate fluid daily. Which of the following is most likely medication? The options are number A, diazepam, number B, haloperidol, number C, lithium carbonate, number D, monoamine oxidase inhibitor. وكيف الفيديو هنا اختار الخيار اللي بتشوفه ازاي. The correct option is option number C, lithium carbonate. ليه اخترنا الخيار رقم C؟ نشوف rational. Lithium is used to treat and prevent episodes of mania in people with bipolar disorder. Bipolar disorder is a disease that causes episodes of depression, episodes of mania, and other abnormal moods. Activities that provoke excessive sweating should be minimized while taking lithium carbonate, because it can cause the body to lose too much salt, contributing to lithium toxicity. It is recommended also that patients taking lithium should maintain constant dietary sodium consumption and adequate fluid intake throughout the treatment. So the correct option is option number C, which is lithium carbonate. Question number 161. During CPR of an admitted patient following the cardiac arrest, 2 DC shock and 1 dose of epinephrine was given. A third dose was delivered followed by antiarrhythmia medication or antiarrhythmic medication. What medication is the most likely to be given next? The options are number A, adenosine, number B, lidocaine 2 mg, number C, epinephrine 1 mg, number D, sodium bicarbonate. وقف الفيديو هنا واختار الخيار اللي بشوف ازاي. The correct option is option number C, epinephrine 1 mg. اخترنا الخيار رقم C نشوف rational. During cardiac arrest, CPR and early defibrillation are of primary importance, and drug administration is of secondary importance. VF, ventricular fibrillation, or pulseless ventricular tachycardia, is treated with direct current shock, DC shock, as soon as possible. If this treatment is unsuccessful after 2 attempts, epinephrine 1 mg IV is administered and repeated every 3 to 5 minutes, plus defibrillation at the same energy level or higher 1 to 2 minutes after each drug administration. So the correct option is option number C, which is epinephrine. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.